Hi everyone, Adam here again from Kinetics Physiotherapy. Should be the final video on patellofemoral joint pain, and this time we're looking at acupuncture or dry needling for patellofemoral joint pain. So we're mainly going to be looking at the quadricep muscles in the front of the thigh. You can look at acupuncture as well towards the hip, the outside of the hip, where that weakness can be as well with patellofemoral joint pain syndrome, but I'm the only one here at the moment. It's quite difficult to do on your own. So I'm just going to show you how to go through the quads. I've got out the plinth just so I can sit. You should have the muscles relaxed so that we can do this. So what I've got here, I've got my box of acupuncture needles. So to do this, make sure you wash your hands. Make sure you've got just some paper towels and your sharps bin nearby. So if you're a practitioner, generally speaking, when we're looking at the quadricep muscles, because it's a bigger sort of group of muscles, they're quite large in comparison to other ones, you can use some slightly bigger needles. So I use the 40mm needles rather than the 25. There are bigger ones out there, not that I use them, but they're more for lower back pain. So just going to in fact, I'll just do the one, see how we get on. So when we're looking at acupuncture for patellofemoral joint pain, got to make sure that the person having the needles is the muscles nice and relaxed. Won't cause any problems if it's not, but it just be a bit uncomfortable really, having the needles put into a contracting muscle. But what we're going to look at a little bit towards this VMO around the inside of the knee here, but also into the thigh as well. You can sort of follow up here. So I'm just going to focus a couple around here, and then maybe do a little bit more towards the main muscle belly of the quadricep muscles. But I'll just do my left leg just to show you guys. So if I take the first needle here, so for anyone who's not seen acupuncture before, it's really useful for settling down sort of some muscle tension in the short term, and also can help with pain, again in the short term. Acupuncture unfortunately doesn't have any sort of long-lasting effects, so it's not going to help you. You're not going to have one acupuncture session and be cured of anything. If you've got patellofemoral joint pain, this might help for anything up to a week sometimes. I've seen it help for longer, but it's not going to solve the problem. What's going to solve the problem is strengthening exercises for patellofemoral joint pain, and these are just a substitute for something like paracetamol or ibuprofen, any sort of pain relief medication. This is just an alternative, similar to the taping in the previous video that I did. Again, it's not a long-term solution, but if we can do all these different things to keep the pain to a minimum and do the exercises at the same time, it just makes that rehab process and that recovery a bit more comfortable for you. So what I want to do, so when you're looking at the acupuncture, it comes in a guidance tube, the needle's in here, and you've got this purple bit on top that's the stopper. So what you want to do is take the stopper out, and I'm just using my index finger here to just sort of gently push the needle, or the hilt of the needle, against the guidance tube there. But it doesn't go all the way through, there's nothing out the other end. But then what you do is you find where you want to put the needle in. So if I go, I'm going to start more towards my knee and work this way, just because of where my hands are. It's much easier to start further away and then come this way. Then I won't be tripping over other needles that I put in. Just going to adjust this. So one of the areas you want to look at is this VMO. So we know that the VMO muscle comes down and then it attaches into the outside of the knee here, and it sits around this area here. You can see a bit more on my right knee here. But essentially it goes this way. So if you were to go directly down, you probably hit the femur, which you can do, but it's not going to do as much as we want it to. So we're sort of going to go at a bit of an angle for the VMO. You're almost going to go this way. So what you're going to do, line it up here, and then that finger, that's that index finger here, you're just going to release that there, and the needle rests against the skin. You won't feel anything here. And then what you want to do is tap the top like that, and it sticks in the skin. And then what you do then is just feed it through like so. Okay, there we go. Empty tube. I usually put the stopper in, just otherwise you end up with stoppers everywhere. And then pop it back in here. At least you know where they all are. So then we'll do the next one. Take that stopper out, secure with the index finger here. So I'm just going to go maybe a little bit higher around here. So generally if you had someone who had tight quads here, you'd feel for areas of tension and sort of work around here. But say I had sort of an area around here, it's usually a bit further up, you'll find it a bit more around here. you wouldn't necessarily go directly into that area that's painful or tight, just because they probably won't thank you much for it. Not in the short term anyway, in the long term it probably help. But you just generally go around it and then sort of finish off with going into that area of tension here. So what I'm going to do, so say for example, I had an area of tension around here. So then what I would do is go in, again, just a slight angle here, let go with the index finger, tap the needle, it's in the skin there, and then just feed it in to the muscle, like so. So whenever you're doing acupuncture, the needle doesn't go all the way in. You just put it in at most about 3/4 or so. There we go, next one here. So I'm just going to go in a bit of a line up my quads here, because I don't have really any areas of tightness, he says. So then rest it against the skin, tap it, and then just feed it in. There we go. And get that stopper. There we go. Pop that on there. And then I'll do a couple more. So then if I just follow this. In fact, because of the video, I would normally just sort of track up the quads, or I would find an area where it's a bit tender and then maybe work around here. You don't have to have hundreds of thousands of needles. You know, at most I got 2 sort of packets out. Sometimes I'll do 10 maximum. Don't really need to cover them and turn them into a hedgehog or a porcupine. It's not necessary. Just pick out the areas of tension, and it stimulates a bit of blood flow to that area and helps it settle down. But just for the purpose of the video, I'll focus a bit more where I put these needles here, just because it's close to the camera and you'll be able to see a bit more. So yeah, coming into here, again, I would press it against the skin, let the needle fall, tap it, and then just feed it through, like so. So just a little one for practitioners. So when we're looking at acupuncture, in the quads anyway, it's a pretty safe area. There's not really anything that you need to worry about, as long as you stay within the muscle bulk. So you've got the VMO here, sort of the medial border, then as long as you don't go into the inside of the leg, that goes into more of the adductor muscles. But essentially you're looking at a rectangle. So that's one point. The other point will be about here, and then you've got another one about here, and then here. And then anything within this box should be fine to go for. And the last one, just going to go this other side here. Rest it against the skin, tap it, and then just feed it in. There we go. So again, the size of the needle depends on the person that you're doing the acupuncture on. So I'm not really worried about needles, but if you have someone that's very scared of needles, I wouldn't jump to the 40s, use the smaller ones. And also, if you have someone who's quite thin, for example, very, very frail, or just generally a bit of a skinnier build, then again, you don't need the massive needle. You don't need the 40s. You just go for the 25mm needles, just because it's not necessary to have such large ones. But then at the same time, if you're even doing a smaller muscle group, say you're doing it for tennis elbow, which I covered in a previous video on, but if someone that's a bit bigger than me, so maybe you've got someone who's a bit of a gym junkie and has much bigger forearms than me, then maybe you put some bigger needles in there. It's not, you've got to use that reasoning there. But generally what we do with these needles, I can't feel them there. You can sort of feel a sensation that they're there. It's not painful at all if anyone's worrying about it. But what you would normally do is leave them in for about 15-20 minutes in total. So I'd leave them for about 5 minutes or so, and then you would stimulate them. So the way that you would do that is go up to one of the needles, grab the hilt here, and you can either twist it in between your fingers like that, or what you can do is sort of pump it in and out a little bit like so. That's what I tend to like to do, going in and out like so. Just feed it in, maybe that a little bit further if it's feeling all right. And then just leave them for another 5 minutes or so, and then do the same thing. You usually do that a couple of times, between 2 and 3 times, and then whip them out. So when you're taking them out, make sure you've got your sharp spin, open that up, and then just take them out one by one. Okay, and just pop that straight in. Take them out there. So as you can see, it's not a painful process at all. Very occasionally, sometimes you can get what's called a twitch response. So when you put the needle in, the muscle will contract and it will twitch very momentarily. It will twitch and then relax again. Can be a bit uncomfortable and a bit of an odd feeling. Again, it's nothing to worry about. Sometimes the muscles, when you put the needles in, will contract around it and then they will relax again. So, didn't really happen with myself, but the reason for the paper towels is very sort of occasionally, again, when you take the needles out, if you've pierced a very small blood vessel like a capillary, again, you're not going to die. Nothing major is going to happen. There's not going to be any problems, but just wipe that off. And generally, because the needles are so small, by the time you've wiped it, it's filled and the blood is clotted. So with acupuncture, the same with any sort of treatment for any condition, you need to have seen somebody first and have a review by a doctor, GP, or a physio that's qualified in acupuncture as well. But I hope that helped sort of settle any nerves for anyone who's nervous about having acupuncture, or a bit of a refresher for any clinicians. And if I do get someone in that's happy for me to film it, I'll show you the technique for going around the outside these hip abductors here and how to towel it correctly, so sort of retain some modesty for whoever you're acupuncturing. So that sort of concludes this video. Again, if in the future, if there's anything else you want me to cover, leave it in the comments section below. I'm more than happy to cover any future videos that you guys want. Leave a like and subscribe as well, and I will see you in the next video. Thanks everyone.